Hello, good morning everybody. Today I am Dr. Udaykumar, HIV specialist from Life Care Clinic, would like to talk to you on an important topic, and that is how to take a consent. Now, what is consent? Be careful. Before going into the topic, we should all read this, and people who are new to this channel can subscribe to my channel. Anybody who like the content can hit the like button also. So, consent, a very important topic which we most of the time miss doing in our practice, and later we regret not doing it. Since the medical profession has come under medical legal consent, we need to know what consent is, how the patient is, and what kind of issues can be seen in the future. So, what is the consent? Consent means to agree the same thing in the same sense. That means we need to agree on the same platform and the way we look out to the problem. Consent is valid only if given by a person who is, number one, an adult. An adult is a person who is more than 18 years of age and who can sign or read and write and understand. In case of minor, the lawful guardian can give the consent. On secondly, he should be of the sound mind. In case of a lunatic or persons of unsound mind, the lawful guardian can give the consent. So we should verify the age. We should verify the mental status of the patient. We'll see the details of all the things, and though looking very simple or small issues, but can create havoc in the future. So, what kind of consent are there? There are two types of consent. Number one, implied consent, and number two is express. Express form of consent can either be a oral or a written, but it is always prudent to obtain a valid written and informed consent wherever necessary. Such consent safeguard the interest of the attending doctor in case of litigation. So, we should always be aware of the written consent, and we should have it in the form of writing in which the person understands or the client understands. So, if person can read and write in the vernacular language of mother tongue is Marathi, the consent should be in Marathi. If it is in English and the person has signed it, then it cannot be a valid consent. So there are some issues in which we have defined it, and as per the law, the Kerala High Court in the division bench of Kerala High Court, T.T. Thomas versus Edisa has held as follows: consent from the patient is evidently not for the safety of the patient, but the protection of the physician or the surgeon, as the case may be. So, the High Court has clearly mentioned it is the doctor who is in the risk if not taking the consent. So, if the consent is given, then we can understand the patient is aware of the drawbacks or shortcomings that can happen, and we need to understand the concept in a same manner. So, HIV testing, is it mandatory or voluntary? The question is whether HIV testing should be made mandatory or whether it should be done on a voluntary basis. This is a big debate, and lot of people have seen that when mandatory testing is done for HIV, then it will discourage people from getting themselves tested and force them to go underground, fearing discrimination and social ostracism. As we know that HIV can be a risk, but it can be a risk at some times when a person is exposed to risk, and if the person after getting a risky exposure goes for testing, that would be in the favor of the person, that will safeguard the interest of the person, and as we know, we have treatment that can lead a person a healthy life. So this will help in finding the proper way of treatment, not discriminating the person. So the HIV testing should not be mandatory, but it should be voluntary. The various views are in favor of testing for HIV on a voluntary basis and after a return in consent. Many a times it is seen that people do not take a written informed consent and they do not tell the person that what can be the pros and cons of testing, which can lead to having some kind of insecurity or disbelief in the knowledge of HIV, and the person can be in a mental disturbances. That's why the government of India, in accordance with the WHO guidelines, has issued an HIV testing policy. So, number one, no individual should be made to undergo mandatory testing for HIV. So, it is not mandatory. Whatever you want to do, it should be with a written consent and it should be done voluntarily. Second, no mandatory HIV testing should be imposed as precondition for employment or for providing healthcare facilities during employment. So, HIV testing is not mandatory for any of these. However, in case of armed forces before employment or HIV screening can be carried out voluntarily with pre-test counseling and the result can be kept confidential. That means that even if person turns out to be positive, doesn't mean he would suffer from unemployment or should be executed out due to the health status. Okay, HIV is just a test, is just a virus that is in the body. It is not AIDS. Okay, HIV after few years then turns into AIDS, and thus there is a difference between HIV and AIDS. So, in case a person likes to get the status verified through testing, all facility should be given to the person and the result should be kept strictly confidential. Such results should not be given out to the person and with his consent to members of the family. So it should be kept to the person only, not to the members of family. The attending physician should invariably disclose the HIV status to the spouse or sexual part of the person after proper counseling. So it is not that we should just go and explain that. However, the person should also be encouraged to share this information with the family for getting proper home-based care and emotional support from the family members. So it is the duty of the physician to understand the concept, then make his patient or the person aware of the disease and then ask the person to disclose the information to the family for proper information, proper support, proper curing of the disease. So there was an issue with the Pondicherry State Consumers Dispute Resolution Commission that was held in V. Vasanda Kaumari versus Dr. T.A. as follows: that the dialogue between patient and surgeon is an utmost necessity, and at each stage the patient should be informed or the patient ready should be informed about the possibilities, and the patient allowed to decide freely without any amount of influence by the surgeon, who may have his own ideas and his own preferences. So the patient should get the authority to understand and tell about the possibilities of the consent. Even if we consider about the mentally challenged, unsound or minor people, there are occasions when consent cannot be obtained for the patient. So the guardian is taken by the Indian Penal Code, which protects the doctor from any criminal under such circumstances. So in this photo, as we see that mentally, as depicted in the movie, the children or the actor in the lead role was mentally unsound, and in such situations we can understand that we should have other kind of ways of taking the consent by the parents. So the Indian Penal Code and the consent, it allows that, it tells us that if the act is done in good faith for a person without consent, so nothing is an offense by reason of any harm which it may cause to a person or whose benefit it is done in good faith, even without that person consent. If the circumstances are such that it is impossible for that person to signify consent, or if that person is incapable of giving consent and has not guardian of giving consent, or the person is lawful charge of him from whom it is possible to obtain in time for a thing to be done with benefit. So it is the person who acts as a person of good faith, and from him we can give the consent. There are certain exceptions to this, but that cannot be included here beyond because they are beyond the scope of this topic. The above provision of law protects the doctor from criminal liability if an act is done without consent of the patient in a good faith when, number one, it is impossible to signify the consent. For example, a comatose patient or patient who is unconscious. So at that time, it is not possible to take. Secondly, if patient is incapable of giving consent, for example, of unsolved minor, it is possible that if an emergency medical condition arises and the consent of the guardian cannot be obtained in time, and the lapse of time can dangerous to use to the life of the patient, then we can act in that emergency concept. So merely signing the consent form does not exclude doctor's responsibility. If he is negligent in carrying his duties, then definitely he is punishable. But a consent means that we explain the risk while doing the issue with the patient, and the relatives and the patient understand in a same platform what are the risks. For example, if a person is having a diabetic foot or gangrene of the foot, so we explain the patient's relatives, yes, that this gangrene can spread, and in the good favor of health of the patient, we need to do a amputation. So having this consent, we can say that this particular risk which is there can be a life threatening, and having the leg amputated can help the person to get rid of the disease. So it is clear that the attending physician or surgeon is not absolved of charge of negligence, if any, on his or her part only because the patient has affixed his or her signature or thumb impression on the consent form. This means that a consent given a patient does not protect the attending doctor from liability in case of negligence. So negligence is out of the question. We are doing this in a way to help the patient and the relatives to get the most possible medical attention in case of a procedure, test or surgical intervention which is opted with its attendant risk. So the High Court of Kerala said that in case of HIV testing, the patient needs to be informed about the implication of HIV testing and the necessity for conducting the HIV test. So it is not that we can just do a test without telling the patient in suspicion. We have to make the patient understand what and why we are undoing the test, what are the benefits of doing the test, and how this test can help the person in the health of the near future. So before a blood test of a person is ordered, his consent is required. The reason is that this is a constraint on his personal liberty and cannot be carried without the consent. Whether even a legislature can compel a blood test is doubtful. So the Kerala High Court judgment is said that the permission of conducting a blood test on a child to prove the paternity of the child, the applicant in the instant case disputed the fact that he was the father of the child. So this was an issue for which attending the blood test to determine the paternity, there is no reason why entirely different sensation should be applied in case of consent to be obtained before HIV testing. There are few variations we have seen in Goa and Daman Public Health that the people there various issues by doing a forcible test for HIV, which was there in 1958, but after that this was revoked. The Act of 1985, and after that it was revoked because the Act said that section 53(1) that if the health officer is a person suffering from any infectious disease and that such person is without proper lodging or accommodation or without medical supervision directed as prevention of spread of the disease, then the health officer can not work on this particular issue. So nobody can refuse, including a foreigner, for investigation of blood required for acquired immunodeficiency syndrome, that's AIDS, and other communicable or infectious disease if the health officer has reasonable ground to suspect that such person is suffering from AIDS and other serious infectious diseases on the Act. So any person who will be found positive, that time government had many other issues in which they were considered not suitable for the institution, or they should be shifted to institution where these patients were treated. So then now, as we know that HIV and AIDS can be treated properly, diseases can be controlled and cured if the opportunity infection can be cured if treated in a proper time frame. So there are a lot of issues that were there in Andhra Pradesh also. There were some issues in which they found that people who did not want to test for HIV, they can increase the chances of having HIV as a public health issue. So it was asked them to do a testing of the HIV, which was important and to control the disease. So there was a conflict between the privacy of a person suspect of HIV and not to submit himself for civil or medical examination and the powers and duty of the state. But later it was found out that if we test, then we can do a better work, and this testing should be done for the improvement of the public health. So there was an appeal which was made against the judgment, full bench of the Andhra Pradesh High Court, however pending before the Supreme Court. So there are ethical guidelines for all this type of testing. Even if you are doing a biomedical research on human subjects, then during the experimentation for doing drug trials or even there are vaccine trials for HIV/AIDS, it is essential as per the ethical guidelines of biomedical research on human subject issued by ICMR that research subjects are informed about the type of the research involved. Secondly, the risk of the research subject exposed to, and the right to withdraw from the further participation of the research, that is indicating the subject has voluntarily enlisted for the research of drug trial and written informed consent is taken. So all these things we should be included in the consent form, and person should understand why and how the risk that is pertaining to research can infect his body as well as his career. So the mandatory testing can be allowed under the following circumstances only. Number one, if a person is a semen donor when we know it's unknown donor. Secondly, organ tissue donors are there, and third, blood donors are there. Now, we do not have mandatory testing doing this right now, but these three situations are important, as the donor, when donating the part of the body, if he doesn't know that he's carrying some disease, can transmit the disease to other person. In such circumstances, the purpose of the mandatory testing is obviously to protect the health and life of the recipient. So we should have this kind of testing, and semen donors should have HIV testing. Even organ tissue donors like heart, lungs, liver, kidneys, intestine, pancreas, or cornea, tendons, valves, veins, and skin and bones, we should do a HIV testing of the person. Even blood donors, right now we only test the blood sample, we do not test the blood donor, and this also has a risk, and we should also work in this particular direction of treating. Please tell me in comments that do you think is this mandatory testing of blood donation, blood donors or semen donors must, and how we can have this particular thing done. So the important points we get from this discussion is that the emphasis on the voluntary testing for HIV infection is opposed to the forcible testing. Secondly, certain laws permit mandatory testing for HIV infection under certain circumstances, but these are special laws. Although not mandatory, it is prudent to obtain written consent for the patient or the guardian whenever necessary before HIV testing, and proper discussion with the patient or the guardian, as the case may be, regarding the HIV testing and its interpretation prior to obtaining consent is necessary. So all the things are very clear. There are special laws where we have to do mandatory testing but still not implicated, and I would ask you to comment in below that have you tested for HIV, and should people get tested for HIV? People before marriage, having marriage, should they get tested for HIV? Should HIV testing made mandatory premarital situations, and how we can tackle HIV and AIDS in India? So concluding, I am Dr. Udaykumar, the HIV specialist. If you have any issues, we can WhatsApp me on my number and we can talk about this. We also have paid consultation, and if you want any drugs, we are available at the Result Privacy at our clinic, and my address is at Aurangabad Jalna Road opposite Amarpit Hotel, and we are closed on Sundays, and rest of the days we are open from 9 to 6. Thank you very much for your time. Do think over it, comment in the comment box, and let me know the future of the HIV testing in India. Thank you very much.